Fractures can happen to anyone, and when they don't heal the right way, they can cause lasting pain and mobility issues. St. Alphonsus is raising awareness about specialized fracture care available right here in the Treasure Valley. Joining us is orthopedic trauma surgeon Dr. Daniel Bechtold to explain what makes fracture care unique and how personalized treatment helps patients get back to the life that they love. So a warm welcome to you, Dr. Bechtold.
Thanks for having me.
All right, so tell us what you do as an orthopedic trauma surgeon and what makes your role at St. Alphonsus so unique.
Yeah, so orthopedic trauma surgeons are people who have done an extra year of specialized training in managing fractures. These are fractures that can happen to anyone at any point in time and can be from simple to very complex. Our role at St. Alphonsus is to try to streamline this and provide expert care of people who've done additional training in managing these, who can bring all the tool set to meet you at your point in life and help you get across the line in healing. So we take tools including fracture fixation, non-operative care, and even joint replacement to meet patients where they are and get them back moving and back to their goals and address their life and their goals.
Okay, what happens when a fracture, though, doesn't heal properly?
Yeah.
And why does that happen?
Yeah. So we don't always know. Okay. Up to 5% of fractures don't heal, and there can be varying reasons. It can be something simple like your metabolic status, simple genetic things and how you carry vitamin D or your bone healing capacity, or more complex things like a fracture that has had an infection that we didn't recognize to begin with, or that wasn't aligned perfectly to begin with. So one of the things that I think we bring to the table as fracture trained specialists is identifying those. We partner with our PAs and our bone health specialists to identify these problems, to meet those head on, and oftentimes work in concert with them to address the metabolic demands while we address the fracture specific things like alignment and stability in the surgical theater.
Okay, and what happens if it doesn't heal properly?
Yeah, so when a fracture doesn't heal properly, people end up with chronic lasting pain. This is the sort of thing that can affect the quality of life and have similar outcomes to end-stage heart disease, end-stage lung disease on people's quality of life. So when a fracture doesn't heal, we need to take steps to get them back to their quality of life.
Yeah, absolutely, so they can move,
yes,
right?
Yeah,
they remain active, which we know is so incredibly important.
100%. One of the big things we need to do, remain mobile, and when we aren't mobile and we are immobilized for prolonged periods of time, we lose that function.
Yes, okay. And how do we help fractures heal? You gave some details there. And why does personalized care matter, though, in this situation?
Yeah, so we need to meet our patients where they are. In Idaho, we have a very active population.
Yes, we do.
But we have people of all qualities and walks of life. We have young, active football players or firefighters who need to get back to work saving lives, right? And we have grandma who wants to just be there for her newborn grandchild and be able to hold them in her hands. Personalized fracture care matters because it meets people where they are, understands their biology and then their goals, and tailors the care to those people. I think that's vital to getting people the quality of life that they deserve and that we should be able to provide as expert physicians.
Okay, and give some advice too for our viewers right now, those watching. What can we do to help support our own bone health and prevent fractures?
Yeah, so all of us have bone health that proceeds in a predictable manner. Okay. Our bone quality improves to about 30, and then it declines. And it declines for a variety of different reasons. But each of us can take preventative steps to help with that. One of those is impactful exercise, right? We want to have high impact exercise 3 to 4 times a week, 45 minutes at a time, so that we continue to strengthen our bones. Another one is avoiding excessive alcohol and excessive nicotine, which can affect our bone health long term. And then finally, just eating healthy and remaining active overall, keeping a healthy body weight so that we can age gracefully.
Okay, and also one more piece of advice. When should somebody seek care?
Yeah, so if you've had a fracture and you've gone 6 months and you have persistent pain or you are not seeing progressive healing on your x-rays, reach out to your surgeon and ask if a referral to a fracture specialist for a further evaluation may be a benefit for you. If you're not seeing improvement at 6 months, you're probably seeing deleterious effects on your life quality as well as your long-term prognosis of getting a full recovery that we should address at that point, whether that is simply addressing the biological insult, restoring your vitamin D, getting you on a better diet, or if there's a surgical need where you need a fracture specialist, myself or one of my partners, to take on a more complex surgery.
Great. And where do our viewers go so they can learn more?
Yeah, so go to stalphonsus.org/fracture care, and you can see our team of orthopedic fracture specialists. Get plugged in to get an appointment tomorrow to be seen, and we can get you in within a week typically to evaluate your fracture needs.
Oh, that's wonderful news. Dr. Bechtold, thank you so much.
Yeah, thank you for having us.